everyone, this is Suprava. Welcome back to another session of Identification and Management of Congenital Anomalies. So in the last session, we have discussed about the congenital anomalies, what we mean by congenital anomalies, and what are the risk factors, what are the etiologies, and what are the different diagnostic approaches that are present. So I hope you all are clear till that. Now today we would continue from the rest of the part. So today let us start with what are the congenital anomalies are there. Those are present at birth. So we would see system wise what are the congenital anomalies are there specifically in a particular system. So first let us start with central nervous system. The central nervous system include varieties of congenital anomalies such as anencephaly, spina bifida or hydrocephalus, microcephaly, macrocephaly, etc. Here in this unit basically we would just get used to with the terms and we would know that what are the congenital anomalies are there in a particular system. But in a detail we would not learn now. So what are these diseases? Basically the details of it that we would learn it in further chapters. So here as you can see the picture of anencephaly, you can understand that the part of the brain or skull is missing here. So basically the baby is born without certain parts of the brain or skull. Then there is spina bifida, which is also related to central nervous system. So this is also a congenital anomaly. And then we have hydrocephalus. So here as you can see in the picture that the newborn is having a large head. Now why it is, what is the cause and how does it happen, those things we will learn when we will learn about hydrocephalus. Next we have microcephaly, whereas we have two pictures here. I think you can understand that here the head is small. So that is microcephaly. Likewise, we have macrocephaly where you can see the size of the head is relatively larger and that is because of the enlarged brain. What are the causes of this macrocephaly that we would learn when we would learn about macrocephaly. These are some of the congenital anomalies. Those are related to central nervous system. Now let us move to cardiovascular system. So there are several defects of cardiovascular systems which are present at birth such as VSD. So that is ventricular septal defect. As I told you that this is related to cardiovascular system. This is a defect of heart which is present at birth and basically we have two ventricles at the lower part of the heart. So basically what happens in VSD that there is a hole on the wall of these ventricles. That is what is called as ventricular septal defect. We would understand it in detail in the later unit. And then we have ASD, that is atrial septal defect. As I told you about VSD, that is ventricular septal defect, that there is a hole on the wall of the ventricles, that is ventricular septal defect. Now here we have atrial septal defect in which there is a hole in the wall of the atrium. So this is also a birth defect of cardiovascular system. Next in congenital heart disease we have PDA, that is patent ductus arteriosus. Patent ductus arteriosus is something from the name itself we can understand that there is a ductus arteriosus which is patent. What is this ductus arteriosus? That to understand that learn the fetal circulation. So there we would learn what is ductus arteriosus in detail. Basically what happens after the birth, this is an opening which is present at the fetal life, but once the baby is born, after that usually this opening closes on its own. But for whatever reason if it remains open, then we call it as patent ductus arteriosus. Next we have coarctation of aorta. This is basically narrowing of the aorta. And then we have transposition of great arteries. Basically here the transposition of arteries, that means there is alteration in position. So we have pulmonary artery and we have aorta. What happens in transposition of great arteries? That these two arteries, that is pulmonary artery and aorta, these are transposed. Their position is switched. That's what happens in transposition of great arteries. Now next we have tetralogy of Fallot. In the name itself there is tetralogy, that means combination of 4 heart defects that are present at birth. Well, so this basically affects the blood flow in the heart. Apart from these things, we also have aortic stenosis, as you can see in the picture, that aortic valve which is present with stenosis. And then we have pulmonary valve stenosis, as we have two pictures. There's a picture of normal heart and then there is a picture of pulmonary heart with pulmonary valve stenosis. These are some of the defects of cardiovascular system, or we can say congenital heart defects, which can be seen in newborns. Now next, moving to gastrointestinal system. Here in gastrointestinal system we have tracheoesophageal fistula. In tracheoesophageal we are getting two names, trachea and esophagus. This tracheoesophageal fistula is basically there is an abnormal connection between the trachea and the esophagus. And normally there is no connection between the esophagus and the trachea. But in this picture, if you see clearly, you can understand that there is an abnormal connection between the esophagus and the trachea. The esophagus that is supposed to go to the stomach and the trachea that is supposed to go to the windpipe and then to the lungs. And the trachea that basically leads from the throat to the windpipe and then to the lungs. So this is a defect of gastrointestinal system. Next we have esophageal atresia. So esophageal atresia is congenital malformation, and in which we can see that the part of the esophagus is not developed properly. So esophageal atresia is also a congenital anomaly of gastrointestinal system, in which we can see that the part of the esophagus is not developed properly. Next we have pyloric stenosis. So here we have a picture of pyloric stenosis, and you can see that the pylorus is thickened. So there is presence of stenosis, and that blocks the food from entering to the small intestine. Next we have anorectal malformations. So this is basically related to the birth defect of the rectum that interfere with the normal passage of the stool. Apart from these things, we can also see malrotation of gut. Then there are several types of hernia. There is congenital intestinal obstruction and also Hirschsprung's disease. So next, let us understand what are the congenital anomalies present in the respiratory system. In the respiratory system, again, tracheoesophageal fistula, as this is something that is related to the respiratory system also, because there is an abnormal connection between the esophagus and the trachea. That is why we can say that a tracheoesophageal fistula is something that is a birth defect of gastrointestinal system, and as well as it includes the respiratory system also. And then we have congenital atelectasis, then congenital stridor, congenital cyanosis, etc. After this, we have genitourinary system. So in genitourinary system, there can be hydronephrosis or polycystic kidney disease. Then there can be congenital phimosis, congenital hydrocele. Then there can be undescended testis and malformations of reproductive organs. Next, coming to musculoskeletal system, in that we have club foot. So here, as you can see in the picture, that the baby is born with a feet that is turned inside under, and this is also called as talus. So apart from club foot, there can be congenital dislocation of hip. Then there can be congenital scoliosis, Marfan syndrome, or muscular dystrophies, etc. Now moving to blood disorders. In blood disorders, we have thalassemia, then hemophilia, then there can be sickle cell anemia, then there is congenital spherocytosis and G6PD deficiency. So next is metabolic disorders. In metabolic disorders, we have cystic fibrosis. Basically, what happens in cystic fibrosis is that it affects the cells that produce mucus, sweat and digestive juices. Basically, this is an inherited disorder and it affects the lungs, the digestive system and the other organs of the body. Then we have phenylketonuria and G6PD deficiency. Also, there can be congenital lactose intolerance. Then there can be glycogen storage diseases or Wilson disease or inborn error of metabolism. Well, the next one is about endocrine system. So in endocrine system, we can see congenital hypopituitarism, that is also called as dwarfism, and there can be congenital hypothyroidism, which is also known as cretinism. Then there can be congenital goiter or diabetes mellitus. So these are some of endocrine disorders that might be present at birth. Now next, moving to the chromosomal abnormalities. So in chromosomal abnormalities we can see Down syndrome. So that is also because of trisomy 21, and then there is Patau's syndrome, that is trisomy 13. Then we have trisomy 18, which is known as Edwards syndrome, and then there is Turner syndrome, Klinefelter syndrome, or Cry-Du-Chat syndrome. These are the chromosomal abnormalities, and in Cry-Du-Chat syndrome, there is cat-like cry of infant. These are the congenital anomalies that we saw based on the system. So particularly in each system, what are the congenital anomalies are there. Now apart from these things, there are certain congenital anomalies which we can call it as miscellaneous. Basically, these congenital anomalies does not fit into any particular system, or we can say any particular categories. For example, there is cleft lip, cleft palate. Then there is congenital cataract. Then there can be congenital glaucoma. Then congenital deafness, mental retardation, etc. These are some of the congenital anomalies which does not fit into particular categories. This we can term it as miscellaneous. Till now, we understood that what is congenital anomalies in general. It is important to understand what are the preventive measures, how we can prevent it, because that is very important. So next, let us understand the prevention strategies. So when we talk about prevention of congenital anomalies, there is a very important aspect which comes, which is genetic counseling. This is considered as a true preventive measure of congenital anomalies. We would see what is this genetic counseling, how we should do it, in what situation we should do it, that we will see in the later slides. Next, let us see what are the other preventive measures that are there. So the second one is we have to discourage consanguineous marriage. Now if you remember the etiologies, we saw that this is one of the major causes of congenital anomalies. So if there is consanguineous marriage, that holds a high risk for congenital anomalies. So that's the reason we have to reduce it and we have to discourage the consanguineous marriage. Again, one more cause was advanced maternal age. As a nurse, you have to educate people that if they conceive beyond 35 years of age, there is a high chance that they might give birth of a child who would be present with a birth defect. So we have to avoid these things. We have to educate people, and we have to educate them that to avoid late pregnancy, specifically after 35 years of age. The next thing is we also saw that malnutrition plays a role in congenital anomalies. Here we have to promote the health of the girl child, and also we have to check the health status of the pregnant mother. We have to prevent malnutrition, anemia, and if there is any sort of deficiency such as iodine deficiency or folic acid deficiency, etc. Then next we have to encourage immunization. It is very important for all the girl children to receive immunization, especially MMR. These infections like mumps, measles, rubella, these infections might cause some sort of birth defect in later period. And then we have to increase the attention about the protection of individuals, such as from X-ray or from any other ionizing radiation, or drugs, alcohol, which can cause mutations in gene. So there are certain chemicals also. So about these things we have to increase the awareness in people. And then if we have Rh negative mothers, if they had an abortion or if they had their first childbirth, after that we should immunize them with anti-D immunoglobulin. With this we can prevent Rh hemolytic disease. And then we have to educate them, and then we have to try to eliminate the active and passive smoking by the mother. We have to educate people about avoidance of taking drugs which are not prescribed by the physician, and especially in the first trimester. And then there's one more factor which plays a major role, that is infection. We have to avoid intrauterine infection, and for that sexual hygiene and the other hygienic measures, the general hygienic measures are very important. We have to educate the mothers about the sexual hygiene and the other general hygienic measures, and how they can prevent the infection, how they can prevent the intrauterine infection. And then also we have to provide efficient antenatal antenatal care. It includes everything. Efficient antenatal care means starting from diagnosing that if there is any risk for congenital disorders, any genetic disorders. The next, there is efficient antenatal care. So for efficient antenatal care, it includes a lot of things, that is starting from diagnosing if there is any risk for genetic disorders, and then there is assessment whether the mother need any sort of supplementations, and then planning a proper diet for the mother so that we can prevent malnutrition, and if in case any abnormalities are found, then there should be appropriate treatment for that. In efficient antenatal care, we have to do all these things, and to prevent congenital defect or congenital anomalies at birth, antenatal care is very important. So we have to make sure that the antenatal care we are providing, that is efficient. And then we have learned that there are prenatal diagnosis and the postnatal diagnosis. So if we find out in the prenatal diagnosis, before the birth itself, that there is some sort of congenital anomalies, there is any congenital anomalies present in the fetus, then there should be therapeutic abortion. And then if there is already a child with congenital anomaly, then we have to discourage reproduction second time. What happens is the risk of malformation is increased in the second child, and that is by 10 times more. And then we have to increase the public awareness also. To make the public aware, we have to educate them about the risk factors and the etiologies which causes congenital anomalies, so that they can be aware, and if any sort of risk factors are present in them or any etiologies are there, they can go for genetic counseling before conceiving the child. Next is promotion of detection of the genetic carriers. For example, before the marriage, both the partners, they can do a thalassemia test, and they can see if they are carrier for thalassemia. So these things would avoid congenital anomalies. So these are the preventive measures that we can take to prevent congenital anomalies. Now, as I told you that genetic counseling is one of the best preventive measures for congenital anomalies, let us understand it in detail a little bit. Genetic counseling, what we do, we understand if there is any risk of giving birth to a child, there would be presence of any sort of birth defect, and then we understand if there is any risk factors. So this basically, that's what we do in genetic counseling. This genetic counseling can be of two types. It can be prospective or it can be retrospective. In prospective genetic counseling, we basically aim at preventing heterozygous marriage. And how we do that? By screening procedures and explaining the risks. For example, one of the partners is having thalassemia or sickle cell anemia. In that case, they would be explained with what are the risks of affected children. So this is basically a true prevention of congenital anomalies. And retrospective genetic counseling is basically what we do at the present time. That means hereditary disorder has already occurred in the family. So in this, basically we try to make the parents understand that there is risk of giving birth of a child with congenital anomaly. For that, basically they are advised with contraception or termination of pregnancy and sterilization. These are some of the methods that we use after the retrospective genetic counseling. With this, it is also very important to understand that when to seek genetic counseling. For every couple would not go for genetic counseling. Here we understood that what is the importance of genetic counseling, and with genetic counseling, what are the things that we can prevent, but it is also important to understand when to seek genetic counseling. The first thing, if there is already a child who is born with any sort of congenital anomalies, and then if a family has one or more mentally retarded children, and if there is delayed physical and mental developmental milestones, in that case they should seek genetic counseling so that they would be able to understand whether it is the cause of the disease is genetic or not. In that case, they should seek genetic counseling so that they would be able to understand that whether go for the second child or not. And then if there are certain risk factors, so if somebody feels that they are exposed to certain environmental agents which can affect their genes, that time they can go for genetic counseling. And then if the couples are closely related, that means if there is consanguineous marriage which is happening, So for that, it is always recommended that before that they should know that their risk of having a child with birth defect. These are some of the reasons for seeking genetic counseling. If we are doing genetic counseling, there are certain prerequisites which should be followed. So the first thing is about history. We have to collect a detailed history. So when we are collecting history, we have to obtain accurate history of prenatal, natal and postnatal period. And along with that, we also have to obtain the medical history of any disorders which is present in the family. And then we have to prepare a family tree. Now, this is very important for doing genetic counseling. And then if there is already a child is present with birth defect, then we have to take detailed history and we have to record the clinical examination of that child. And then for that, what are the relevant investigations that should be done to confirm the diagnosis? Those things should be done. And then you should have information regarding the support group, and then you should be aware about the emotional reaction of the parents about how they accept the fact. This is all about genetic counseling. Next, we would learn what are the nurse's responsibilities in congenital anomalies. As a nurse, it is the first and foremost thing which is very important is collecting history. So you have to collect a detailed history, especially the prenatal history, natal history and the postnatal history. Also, you have to collect the history of if there is any medical disorders which is present in the family, and then by interviewing, or you can also do home visit, and then you have to prepare a family tree. And then you also have to identify that what are the present problems, what is the severity of the problems and the nature of the problem, so that you can prepare necessary interventions for that. And then you have to participate in the diagnostic investigations, the treatment procedures, the follow-up, and after that even when there is a research project. And to the parents, apart from these things, you also have to motivate the family members for genetic counseling, and you can refer them to particular clinic. As a nurse, you can also participate in the genetic counseling process, and then you can do individual health education or group health education or mass media health education, and you can educate the people, or you can increase the awareness about the prevention of congenital anomalies. These are some of the responsibilities that you have in prevention and management of congenital anomalies. Let us conclude today's topic. So today we learned about how the different congenital anomalies are there, and we learned that particular system what are the congenital anomalies present. And then we learned about the preventive measures, genetic counseling, and also the nurse's responsibility. So I hope you have got a better insight about the topic. Thank you.